This is a different protocol. We want to make sure that we are modeling the best behavior to keep members of the journalistic corps safe, and of course our staff space. For those at home who don't see this, we are spacing apart members of the media. We will soon be going to a pool camera for future events. I know we weren't able to get that orchestrated today. We want to make sure that we are as transparent as possible, but that the press is able to continue to operate at as close to full capacity as possible when it's more important than ever before to get good information into the hands of Coloradans. As of today, we have 160 positive test results in the state for COVID-19 coronavirus. 20 are hospitalized. And that's just to point out that's what the testing tells us. We know there are likely thousands more in the state of Colorado. Our state has confirmed test results on over 1,200 people. Again, Colorado is ahead of where other states are on testing, but our whole nation is behind. And Colorado is no exception for that. We are doing our best to be one of the leading states, if not the leading state for testing, but scaling that up has been very frustrating and occupies a lot of my time and our operational time to better do that. To be clear, the 1,200 tested does not include in that denominator the negative tests from the private labs. As we scale up on the private lab side, Kaiser's doing testing, UC Health's doing testing, many others are. They immediately report positive test results to the state. They don't have to report negative test results. Again, we're getting some estimates. We're doing our best from a public health perspective, but it's not that one-on-one accurate denominator from all of the private lab partners, because their only requirement is to do positive. And to be clear, anybody with a relationship with Quest or LabCorp can do that testing. We know we need to test as much as possible, not only for the sake of the patient and the uncertainty, but because it gives policymakers and public health officials crucial information about where we need to direct resources and direct quarantine, isolation, and other orders. What is so frustrating about this virus is we are always, from a data perspective, chasing where it was 3 to 5 days ago. We're acting on information because of the incubation period and the onset of symptoms and the testing. The best information we will have is always going to be 3 to 5 days behind what is actually happening through the ground. So we're doing our best to extrapolate, to predict, to use modeling, but the data is a trailing indicator in terms of positives, and then after the positive to hospitalization, and ultimately to whatever the outcome is, there is a significant delay in that. In fact, many of the cases don't require hospitalization for 7 to 10 days into the infection. That's when they enter the severe stage that requires hospitalization. So we are doing our best to use forecasting, modeling, and indicators, but any of the hard data that we get is a trailing indicator. Experts nationally estimate that we are about where Italy was 2 weeks ago. And to be clear, Italy just passed the 2,000 death point today. And well over 10,000 cases, many that, like in America, have simply not been tested. Tomorrow, CDPHE is opening testing in Telluride in partnership with San Miguel County. We're going to be serving folks in the area to better identify the regional concerns, and we're looking forward to scaling up testing across the state as soon as we can with regards to equipment and personnel. Please remember that also Colorado has the capacity for private labs to conduct testing. We encourage anybody who has symptoms or believe they might have been exposed to coronavirus to call or email their doctor first, obtain a doctor's order for testing. Any medical lab or provider with a relationship to LabCorp and Quest, which cover most in the state, can do the testing. But don't just show up. You have to call your provider ahead of time. Look, while testing is important, we can't wait on that. We need to act to flatten the curve, and we need to be realistic. There are likely thousands of cases across the state that have not been diagnosed or tested, some of which are non-symptomatic, some of which are mildly symptomatic, and some of which are likely to enter severe symptomatic stages in the days ahead but are infectious. As I told you on Friday, our goal is to flatten that curve in Colorado to prevent a situation where our healthcare system and healthcare workforce are simply overwhelmed by those needing hospitalization. As I've also stated before, and it's important to know, over 80% of the cases will be folks with mild symptoms not requiring additional medical treatment. Most, but not all of that category are folks that are younger and healthier. But again, this has required hospitalization and has caused death in people of all ages. But to be clear, the danger is much more imminent for those over 60, especially those in their 70s and 80s, and those with respiratory or immunosuppressed conditions. I have a friend who's my age who's had lung conditions in the past and has respiratory conditions, and again, he is high at risk even though he's in his 40s. I am pleased to report that we have 50 new nurses in Colorado today from the Freedom Healthcare Staffing Company. We were able to get them ordered just under the wire. Again, we're hoping that we're a few days ahead of where other states are, not a lot. There's no new surge capacity available now for states who want it, but we got this in under the wire thanks to the emergency fund, disaster emergency fund. 50 new nurses arrived in Colorado today, are being deployed and getting their assignments to support our health needs. I also reiterate my call to registered nurses who are in other fields or have recently retired to contact your previous employer and offer your availability during a crisis if you need to come back to work, and that also applies to doctors, pharmacists, EMTs, and others. I want to thank everybody involved with this effort. We need to reduce the number of vulnerable people exposed to this virus. That's why we issued the strong guidance around limiting visitation in nursing homes, and we also need to engage in aggressive social distancing measures. Given the extreme risk to the high country, over the weekend we ordered the closure of downhill ski areas for a week, again, likely renewable, but we'll look at data. And we strongly advise that all visitors and residents of Eagle Summit, Pitkin, and Gunnison counties, and those who have visited there in the last week or two, minimize social contact. That's really important. We have limited healthcare capacity in the high country, and we also want to avoid disbursement both within the high country and for those who have returned to the metropolitan areas. But we need to do more, and we're announcing some of those initial steps today. Yesterday, CDPHE announced that we're following CDC guidance on preventing crowds of 50 or more from gathering with the guidance on that. I would indicate that we assembled our GERC and met today, and they unanimously voted for us to adopt and to operationalize CDC guidance in real time. So we're going to be doing our best as a state when the CDC issues guidelines to adapt those rapidly and then operationalize those in the Colorado context. Thank you. But again, we need to do a lot more. We're looking at further steps we can take in this area, and we want to make sure that these policies work and prevent the spread here in Colorado. In that same vein, effective immediately, State of Colorado and I are ordering temporary suspension for 30 days, again, renewable, of dine-in services at restaurants and bars. Again, these establishments can remain open, but that's for takeout, delivery, and room service. I talked to a number of restaurants and the Restaurant Association earlier today, encouraging them with additional safety protocols around delivery, around making sure that sick workers don't attend work. And we're closing large places of gathering. That includes gyms and theaters and casinos where large groups can gather. These steps are very painful for our state. And while, again, they may be an inconvenience to you if you're a customer, imagine how difficult they are for the workers and the owners of those facilities, many of whom will have a tough time remaining viable, the workers that will lose their jobs. We'll get to some of the work being done on the labor side, but these are very difficult decisions, the goal of which are to reduce the severity and duration of this public health crisis. Again, you don't want to be penny wise and pound foolish. If you try to squeeze a few more days or week of business into bars and clubs, you'd be looking at a much longer absolute closure and more drastic measures as a result of the lack of foresight that we hope we are showing by taking these actions today. We know that there's over 12,000 small restaurants, bars across the state. And I know firsthand they're some of the hardest business establishments to manage. I've been a success in business, but I've been a failure in the restaurant business. Unlike my predecessor, John Hickenlooper, who did well, I had two restaurants at different times that weren't able to make payroll. One was in business for several years before it went out. It's a tough business. It's tough for the owners, the managers. It's tough for the waiters, the wait staff, the the bussers, and of course the entire supply chain. And there will be a time when we want to celebrate those local small businesses again. When it's safe, we want to go out, we want to go celebrate at bars and clubs, we want to dine out, we want to celebrate in places that we can congregate. But I think you all know who are watching this that day is not today, it's not tomorrow, it's not likely to be next week or the week after. Our hearts go out to the 240,000 employees in the food and beverage industry. Again, we want them to be creative, delivery, carry out other ways that they can continue to operate subject to CDC guidance and public health protocols. Colorado's Unemployment Insurance Division is also responding to many questions from both the employers and the employees. For employees who see a reduction in hours or layoffs, they can apply for unemployment benefits at coloradoui.gov, coloradoui.gov for those workers. Employers may also be eligible for programs to avoid layoffs, like the Work Share program. That allows employers to split the cost to retain employees with unemployment insurance. For instance, if a worker has to be cut from 40 hours to 20 hours, UI could pay 20 and the employer could pay 20. That's called the Work Share program. We are also anticipating additional federal action. Again, with a pending bill before Congress, but likely subsequent efforts as well with regard to the economic recovery as we address this public health crisis. Our state's jobs database, connectingcolorado.com, will continue to post listings for statewide jobs available. There will likely be paid work as well as the need for volunteers to address many of the immediate health care needs and needs of the economy and the public health. And I know that this is a difficult time, but we're in this together and we're going to get through this together. I'm also announcing that all DMV facilities and all Department of Revenue facilities will be closed to the public for 1 month, March 18th to April 18th. But behind the scenes, many of the operations and processes can continue. You can renew online. State driver's license offices will be closed to the public. Again, continue to process the online driver's licenses. And for those that cannot complete renewals online, they can call the DMV call center during working hours at 303-205-5600. Customers who have appointments will need to reschedule those once normal operations have resumed. I also want to make sure that people know that with the closure of many schools in our state, that the Colorado Department of Education has received a waiver from the U.S. Department of Agriculture to continue serving free and reduced lunch to our students while schools are closed. That is the main source of sustenance for many low-income families. We are also encouraging students to take meals away from the meal sites to be consumed elsewhere to allow for that proper social distancing. As many of you know, my Budget Director, Lauren Larson, delivered her update per statute to the Joint Budget Committee about the effect of coronavirus to our state budget and our state economy. While numbers were provided per the statute, I want to be clear that the economic situation is in complete flux. Until we have a better idea what's going on, I wouldn't put any stock in economic forecasts. Everybody is guessing because nobody truly knows the trajectory of both the virus as well as the medium and long-term economic impact. We want to do everything we can to minimize the long-term economic impact of this global pandemic and ensure that Colorado is prepared to come back stronger than ever when this crisis is over. And I know at this time, folks are anxious and feel often that they're not in control. But as we think about it, we really are in control. We're all in control of how we respond in our own lives. There's only so much that any government can do. We all have to take our personal responsibility seriously. And for everybody who is taking this seriously, you are a hero. It's not easy to sacrifice. We're in this together. And we hope to promote a culture of sharing stories with one another. We need to spread the word about what we're doing in best practices and the need to socially distance ourselves. So today we're launching #DoingMyPartCO, where we're encouraging folks to do the right thing and using social media, share on social media with the #DoingMyPartCO, and challenging 5 friends or tagging 5 friends to do the same. So that could be, simply a 10-second video of you washing your hands correctly. It could mean showing working from home, if you can, walking or biking somewhere, watching a movie at home with popcorn rather than going to a theater, FaceTiming with grandma instead of going to visit her, getting groceries or medicine for an elderly neighbor and leaving them on their doorstep. And of course, I also want to make sure, yes, taking it easy on the supermarkets and the toilet paper. There is no interruption to supply chains. We have ag and trucking all functional. There are months and months of supplies that are intermediate to the supply chain. So there is everybody should calm down with regard to that. There is no immediate need to purchase those items. The supply chain is safe, and we want to make sure that we're not causing our own problem here by these short-term runs on products. These are positive steps that folks across the state are doing, and let's share them. I mean, let's be honest, a lot of people are looking for something to do. Let's share Doing My Part CO. Share what you're doing with your kids while they're home from school. Share what you're doing at home if your work isn't allowing you to come in. Share what you're doing if you're in isolation and quarantine. Let's be part of a virtual community together to help reduce anxiety and support one another. I also want to ask our friends in the media to help spread the word about hashtag DoingMyPartCO and help share what we're all doing that shows that we can live with social distancing here in Colorado and protect people's lives. And, you know, in doing right, we know that it can be hard, and that's hard on, of course, you, our residents, in your homes. It means hard on healthcare workers, our most vulnerable. And we're hoping that people do their best to cope with the mental health challenges, the behavioral challenges that come with isolation and loneliness. And that might mean things like taking breaks from watching, reading, or listening to alarming news stories. You can read all day and night about what's going on in Italy and Europe and increasingly here, but you can read an article or two and then, again, take a break. It's bad, but we're going to get through this. We're going to get through this. Hearing about the pandemic all day, 24/7, might be my job to manage, but it doesn't need to be yours. Enjoy those other things in life. Take care of your body. Take breaths, stretch, or pray, or meditate. Try to eat healthy and well-balanced meals. Exercise regularly. Enjoy our great outdoors. Whether it's bird watching or hiking or biking, what a great way to exercise social distancing in an environment where you and your family are in our great outdoors. Our kids went biking today and had a great time. And if you're not in quarantine or isolation, take advantage of our national, state, and local parks and unwind, right? Maybe it's time to start a new book series. Maybe it's time to start a new TV series. Practice an instrument. You could learn a new language. Catch up on family time. Read with your kids. Do craft projects. Play board games or put on a play or Muppet show and share it. And share it with others to bring joy to them, but also to give other Coloradans ideas about what we can be doing in these challenging times to connect with those who are most important to us and appreciate what's most important in life. And yes, connect with others. Just because you can't be in the same room doesn't mean that this crisis can't bring us together. Look through those contacts on your phone. Call a friend or family member you haven't spoken with in months or years. Talk with people you trust about your concerns and how you're feeling. Have a webcam dinner party with friends and family and share recipes and pictures of food on social media. If you've got these ideas, if you're doing these things, if you have other ideas, share them and put the hashtag DoingMyPartCO, hashtag DoingMyPartCO. Look, this isn't going to be easy, but the more seriously we take this public health emergency, the better we can weather the storm and get through this crisis with as little loss of life and as little damage to our economy as possible. The fewer gatherings in the short and medium term, the fewer people at those gatherings, the better the chance we have to reduce the trajectory, to bend the curve, to save lives. And we say saving lives, right? We say, oh, now there's 2,000 fatalities in Italy, and we're where Italy was 2 weeks ago. Italy, a country less than 20% our size. But, you know, let's put a face on those lives when you think about our own behavior, when you think about what you might be doing and how you might be isolating. The face, the life, it could be your grandmother, it could be your grandfather, it could be your aunt or uncle, your parent, and of course it could even be your own that hangs in the balance of the decisions that you make, that we make. So be smart, be safe, don't worry, that doesn't help. Find fulfilling ways to become closer to those who mean the most to you in this challenging time. And let's look out for one another so we can get through this as a state, as a nation, as a world, and get back on our feet as quickly as we possibly can. With that, I'll be happy to take some questions.
You've been watching.
I think we're in the 5 o'clock now.
Are you cold because you don't have your extra shirt on?
Yeah.
You want to sit in the truck?
Yeah, I'll sit in the car.
Oh, just move. Sit. Hang.
I'll sit right here.
Okay.